But thank
Well,
you.
you know, you mentioned the spending growth and obviously the public programs that you are the steward of. You know, one of the great concerns we always have is we want to see real reform and restructuring of the programs as opposed to just, you know, ratcheting down payment. And the movement toward fee for value from fee for service is obviously something that is front and center in that regard and something that we support. Can you give us your perspective on that and how aggressively CMS will move in that direction under your leadership?
Well, I think that we're committed for moving away from a fee-for-service system and moving towards a system that favors value and outcomes. I think there's a couple of issues within there, though. One of them really has to do with around reporting and what is value, what are outcomes, and what are we measuring. I think there's been some challenges around measurement and quality performance in terms of you know, the burden that we're putting on providers. So I will say that that's a component of it, that as we're moving towards paying for quality and value, we have to kind of consider that as well. We are dedicated to innovation around payment reform. I think you're going to hear more from us on our accountable care organizations and how we are going to be looking at that program in a different way. That's coming soon. But I think, you know, generally we are committed to payment reform. One of the things that we did earlier this year is we put out a request for information around coming up with new models around payment reform. We don't think that the best ideas come from DC, and we know that we're gonna have some great ideas coming from the front lines. And so, you know, instead of us sort of coming up with models, we want to hear from people on the front lines about things that we can do. So over this next year, we are taking a lot of that input, and we hope to put out some new models for folks to look at that are based on the input that we've been getting from the front lines.